Hello, I am Dr. Gunjan. I'm working as a consultant in the Department of Pediatrics and Neonatology at Cloudnine Hospital, Patparganj unit. So there are multiple things which can bother your child, and your baby has just one expression in the first few weeks of life. They will just cry to communicate with you. So if you have already changed the diaper and you have already fed the child, there are other things which needs to be looked out. First of all, this temperature can be bothering. If you feel that it's too cold or too hot, both can be bothering to your baby. So if you feel that your baby is sweating a lot or there is some heat rash over the forehead, you just need to decrease the layer. And if you find out that the extremities, by that I mean palms and soles of the body, is cold and they are dusky in color, that means your baby is in cold stress. So you need to basically increase the layer, maybe add caps and mittens to the baby. Then your baby may feel cozy and will calm down. Then there can be some cloth accessory which is basically bothering your baby. So just check it out if there is some pain or some hard, difficult thing which is basically pinching on your baby's skin. Whenever your baby is crying a lot, it's always a good idea that you just expose your baby and see if there is any diaper rash or maybe some other rash. And if there is there and it is quite bad, you need to visit your doctor. After sorting out all these things, if you feel that your baby is crying a lot and this cry is like high-pitched character, it is associated with clenching of fist, curling of legs towards the tummy, this can be a colic cry. And then again, if the crying is like very severe, you should go and meet your doctor. And most of the time you will find out while you are basically traveling with your baby in the car, your baby just become quiet. This is a very common finding. Because this comes to my next part, how do you calm your baby? So first of all is that we can distract our child while your baby is crying a lot. You can move about, you can go to the terrace or maybe you can go to some garden and maybe you can give a drive. If this is not helping, you can, especially if your baby is on bottle feeds, you can try pacifier. This can help sometime because most of the time baby just don't want feed. They just want a proximity and sucking swallowing movement because this releases a hormone called endorphin. So when they are sucking onto the pacifier, this endorphin hormone is released, but they are not getting that extra milk which is going to aggravate the issues. And last but not the least, again, there is a concept called white noise. You can create your own white noise to distract your child. Maybe an exhaust fan can help, maybe operating washing machine can help. There you can just go and stand for maybe 2 to 3 minutes with your baby. You will find that your baby is calming down with this white noise.